Hi everybody, Dr. Daniel. Today I'm talking about how to treat migraine headaches. And I'm going to start with simple drugs and move up to more complicated ones. Migraine is present in 12% of the world population and is generally a moderate or severe headache which is frequently disabling. And treatment needs to be given quickly and at the onset to work best. Starting from the simple things, you could use aspirin. Or you could take it with caffeine, which is called Excedrin or Vanquish. You could take 2 or 3 at the onset, repeat every 2 hours. You're supposed to limit all headache medicine to no more than 2 days a week. You could take Tylenol, Cafragot, which is 100 milligrams of caffeine and a milligram of ergotamine. You could use Cambia, which is an oral solution drug. It's really listed as an NSAID. That's a non-steroidal anti-inflammatory drug, but it has an indication for acute treatment of migraine attacks with and without aura for persons 18 years or older. And you give a single 50 milligram dose at the beginning. Migranol, DHE, nasal spray, can be used. Or Trodesia, which is a new drug that's out now. Both the Migranol and Trodesia have DHE in them, which is a long, well-respected, well-used migraine acute therapy drug. Or you could use dihydroergotamine, which is DHE, intramuscular, or in hospital it can be given IV. Then for cluster patients, persons can use nasal oxygen, and sometimes that'll work for migraine as well. And generally, what we use for triptans and most successful drugs, although they've been out about 30 years, are triptans. Now, these drugs should not be used with a personal or strong family history of coronary artery disease, and don't use it with patients who have uncontrolled hypertension. There's a limited dose in children and elderly, and patients with complicated migraine like basilar artery migraine or complicated aura symptoms over 40 minutes. And you shouldn't take triptans with ergotamine within 24 hours because they make you sick doing that. Common triptan side effects are chest tightness or pressure, near fainting, neck or back pain, which may be burning, warm or hot, dizziness or drowsiness. And those are usually benign and go away quickly. Well, triptans and SSRIs or SNRIs, those are drugs for anxiety and depression, has erroneously been reported that there's a rare risk of development of serotonin syndrome in patients who take triptans and these drugs. But the risk is estimated to be very low. And in recent review, migraine experts have recommended that there's really no problem doing that, and it's okay to take. So the most popular and the first drug that came out as a triptan was sumatriptan. Name was Imitrex. It can be given orally, nasal spray as a shot. There's a Sumavil Dose Pro, which is a transdermal use of Imitrex. There's an oral tablet of Trexamet, which has a mixture of naproxen, which is an NSAID, and sumatriptan. That combination seems to work better. So all of the oral triptans, and I'm going to mention the other 6-7 in a minute, in addition to sumatriptan, can be mixed with naproxen, 500 milligrams, and they seem to work better than the triptan alone. Zomig, or zomatriptan, is another drug. It has a nasal spray and a tablet. Maxalt has a melt-in-the-mouth drug and tablets that can be swallowed. Axert, which is almatriptan, is an oral tablet. Relpax elatriptan is oral tablets. Emerge, which is naratriptan, also has a long-acting duration lasting 6 hours. And that comes as a tablet. Frova, or frovatriptan, has a special use in menstrual migraine, and in that situation you can take 1 a day for 2 or 3 days. And it takes about 2 hours for it to work, but it can last 26 hours, a half-life of the drug. I have a web page on the same subject up at drmigraine.com, and there I have all this data listed. You can read, it may be easier to see. There are also medical devices that are used for acute therapy for migraine. There's a drug called Cephaly, which is electronic device that provides acute and migraine treatment for migraine. It's an electrode that attaches to the forehead and sends pulses to the upper branch of the trigeminal nerve, which regulates migraine pain. There's a device called Gamma Core, which is effective for patients who failed traditional oral injectable medications, or people who just want to try some kind of device and don't want to take oral medicines because they have side effects from it. There are new oral pills for acute therapy, and these are called ditens. I'm sorry, there's a diten called Rayval, which is lasmiditan. It's the first of a new type of treatment called a diten. It can be taken at the onset. And there are some drugs that are called Gepants, which is Neurotech, which is Rimegepant. And Ubrevely is also drugs that can be taken at the onset of a headache. The summary here is taking one of the fast-acting triptans at onset is still considered to be the best treatment for most persons with migraines. And triptans don't work for 20-30% of patients, and there may be triptan contraindications, as I mentioned above, with hypertension, heart disease, stroke problems. And this is where the new Ditin drugs and Gepants can be used. So those are my thoughts on acute therapy for migraine and how to treat migraine. I hope they're helpful to you. Please click on the subscribe down there. Follow me on podcasts for other talks on migraine. God bless all you folks, and I'll see you again on the next talk.